Well, you have probably heard of the STD, human papillomavirus, better known as HPV. Did you know that about 8 out of 10 women will carry HPV? That means 80% of women will have this virus at some point in their lives. This HPV virus is more common than you might think. So let's see how much you think you know about it. Take a look.
What is HPV?
HPV is
that a disease? Something virus.
HPV is the human papillomavirus.
Do you know how you can get HPV?
I think you can get it by blood.
You can get HPV by having sex with the wrong person.
Well, if it's an STD, I guess you get it through intercourse.
Through sexual intercourse, I believe.
True or false? HPV can cause cervical cancer.
True. True.
True or false? You automatically get tested for HPV with your pap smear test.
I don't know. No, you do not automatically get tested for HPV with a pap smear test.
Men cannot get HPV.
I think they can. False?
Probably false.
Knowledge is power. So let's arm ourselves with more info this morning about HPV. Please welcome aboard a board-certified gynecologic oncologist, Dr. Bradley Monk. Good morning to you, Dr. Monk. Thanks for being here.
Danielle, thank you. I really appreciate this opportunity.
Glad you are here because, listen, we know HPV is a sexually transmitted disease, but how do you know you have it?
Sexually transmitted disease, that's interesting. I look at this virus as a cancer-causing virus. It's true that you have to touch someone to get it, but it's not like chlamydia, gonorrhea, or syphilis where you have to touch the wrong person, okay? This does not imply sexual deviance or promiscuity. 80% of us get it, but most of us get over it and never knew we had it. We can test for this virus right on the cervix to see if you're one of those rare individuals that could not get over it, that's a chronic carrier.
Interesting you say that, and I'm just on a personal note, my mother had cervical cancer several years ago, and so I do have a little bit of knowledge about it based upon what she went through. And one of the things that I do know is that women have to be proactive about this, and they actually have to ask for the HPV test, right? Is there one common HPV test or what's out there in the marketplace? Because quite frankly, other women may not know when they go for their pap smears that this is something you have to ask for, right? It's not part of your regular pap smear procedure.
Most of the information is from the Digene HPV test. That's where most of the studies were done. And if you were to ask your doctor, that would be the most common one that would be performed. But you're right. The pap test doesn't test for HPV, but you didn't say it, but you implied the HPV test is better than the pap test. So we used to teach women every year you got to get a pap test. The HPV test is so good that if it's negative, you don't need to be screened again for 5 years. It holds on. And back to your mother, that could have been prevented. There should be zero, none, no cervical cancer today. Between HPV vaccination and HPV testing, we can wipe cervical cancer off the earth, and that's the message.
I love that message, and I think it's a pretty scary diagnosis. Let's say once a woman is diagnosed, right, with HPV and the pap test and she finds out that she's positive for HPV. What does that mean? What are the next steps?
So first of all, don't panic, okay?
That's easier said than done.
So remember, only about 10% of the audience has HPV today, and most of those women will have a negative normal pap test. Okay. So, and we're looking really for the negatives. We're looking for the 90% of women that don't have it because they can be reassured, okay? But if you do have the virus, you need to be watched more closely. Generally, that's repeating another test in a year like the old-fashioned way, and occasionally even a biopsy.
Okay, so now that a woman knows that she has HPV, if she's been sexually active and not using protection with a man, with her partner, how does that then affect the partner? And I know I'm throwing a lot at you, but I certainly want to make sure that we're as educated as we can be.
So remember, HPV unfortunately hurts women more. Okay, the cervix is very susceptible to cancer as a result of this virus. It's true that a man can get head and neck, penile, or anal cancer, but the association is much looser. It's not as common. And so I would not necessarily worry about the man's situation. I would worry about your situation as a woman, trying to stay well, and focus on cancer screening. Remember, HPV testing is just part of cancer screening, like a mammography for breast cancer or colonoscopy for colon cancer. It is the national guidelines. I'm just here to teach your audience to follow the national guidelines. Screen yourself for cancer. protect yourself. Knowledge is power.
Knowledge is power, and I know that you're aware of this controversy that happened, about a year ago? It was an executive order. You out there may know about this, mandating HPV vaccinations for young girls in Texas. How effective is the HPV vaccination?
The vaccine is great, but it doesn't protect against every type. So when we test from the cervix, we test for 13 types. The vaccine only protects for 2.
Oh, wow.
So the vaccine is good for what it does. And remember, the vaccine is only for young people. So if you're, let's say, less than 21, get vaccinated. If you're over age 30, get tested right from the cervix. And if you're in between, you can probably just get a pap test.
You know what I love? I think the best part that came out of this as we wrap up here is really, you say, take control of your own health. Right. Ask for that HPV test, ladies, when you go to get your pap smear, because if you don't ask, you will not receive.
It's great. Thanks, right? Danielle.
Well, thank you so much for coming by. Really good information. Great to meet you, doctor. And if you would like more information on HPV and to find a doctor that performs the HPV test, simply go to the website, thehpvtest.com.